forward. Good afternoon, and welcome to the Voices in Leadership, a series focusing on science and leadership. I am Betty Johnson, and I have the privilege to direct this program and introduce today's guest. Dr. Margaret Hamburg is an internationally recognized leader in public health and medicine, where she is known for advancing regulatory science and modernizing regulatory pathways. From 2009 to 2015, she served as the 21st Commissioner of the U.S. Food and Drug Administration. She was also the founding Vice President and Senior Scientist at the Nuclear Threat Initiative, a foundation dedicated to reducing nuclear, chemical, and biological threats. Her other positions have included Assistant Secretary for Planning and Evaluation, Health Commissioner for New York City, and Assistant Director of the National Institute of Allergy and Infectious Disease. As Foreign Secretary for the National Academy of Medicine, Dr. Hamburg is the Senior Advisor on International Matters and Liaisons with other academies of medicine around the world. She is President-elect of the American Association for the Advancement of Science, as well as an elected member of the Council on Foreign Relations and the National Academy of Medicine. She also serves in various advisory roles, including the Harvard University Global Advisory Council and the Scientific Advisory Committee for the Gates Foundation. A graduate of both Harvard College and Harvard Medical School, Dr. Hamburg is the recipient of many awards and honorary degrees, too many to mention in this setting. Although she has been on Forbes magazine's list of 100 most powerful women in the world, her real joy and honor comes in being one of the 20 most powerful moms. Hopefully she can explain a little bit about that to us today. Before I turn this session over to today's interviewer, Dr. Michelle Williams, Dean of the Faculty, please join me as we welcome Dr. Margaret Hamburg to the Voices in Leadership series at the Harvard T.H. Chan School of Public Health. Thank you.
Dr. Hamburg, thank you and welcome to our school, and thank you for joining us here for this conversation this afternoon. We are really delighted to have you, and I also want to extend a warm welcome to our audience that's online. So I have the privilege of starting this conversation with you this afternoon, and wanted to start with an easy question. You served 6 years in one of the toughest jobs, admittedly, in government as the Commissioner for the Food and Drug Administration from 2009 to 2015. And we're all curious, what in your tenure as Commissioner of the FDA did you see as the greatest challenge in that role? And if you could tell us a little bit the story of how you addressed, that challenge or those challenges.
Well, first let me say it was really a privilege to be the Commissioner of the Food and Drug Administration. It was a very hard job. I don't disagree that it's one of the hardest jobs in government, and perhaps one of the most underappreciated in terms of just how important and unique the FDA is. I mean, I really, in this era of government bashing, would like to say that I think FDA is a great example of government in action to serve the people. Most people don't even understand that the FDA actually oversees products that represent about close to 25 cents of every dollar that consumers spend on products and things that really matter to people, from the time you get up in the morning to when you go to bed at night, the food you eat, the drugs you take, the devices you may need, just such an array of products and important information for consumers to know. It's a hard job because, number one, you are overseeing such a broad range of products and activities because you have such a diverse and committed set of stakeholders and constituents for the work you do and the decisions that you make. It's also at the sometimes treacherous interface of public health science, medicine, and politics. And it's a job where the decisions, make a huge and enduring difference in the lives of individuals and families, like about a drug that may, treat a serious, if not potentially lethal disease, or, the pocketbooks of stakeholders and shareholders in companies. So everything you do is scrutinized. Right. And there is you're operating absolutely in a fishbowl. For me, what enabled me to do the job was the sense of commitment to the mission. FDA is a science-driven regulatory agency with a public health mission to promote and protect the health of the American people. And, I think what I, feel the most proud about and what really was the driving goal that I had was to really restore trust and confidence in the FDA and its important work through lots of different programs and activities in lots of different ways. But when I came on board, FDA was, I would have to say, sort of embattled. There'd been a series of crises, some drug safety issues, some foodborne outbreaks. Congress was, hauling up the leadership of the FDA to hearings. The media was scrutinizing and pointing fingers. The political environment was very charged, and FDA had sort of circled the wagons, and people didn't want to stick their necks out for fear that they might get their heads chopped off. And I felt it was really important, number one, to open up the agency, to explain what we did, how we did it, and why. If people can't see what you're doing, don't understand what you're all about, then they are more likely to revert to suspicion. Right. But if they understand, even if they don't like the decisions you make, I think that it does build trust and confidence. In addition, I felt it was crucially important to make sure that the work of the FDA was driven by the best possible science. And that isn't to say that you always have all the data that you need to make hard, complex decisions. But if you don't use science as your North Star, so to speak, you can get buffeted about by all of the competing priorities, the different stakeholders, the politics. And so that was another critical issue, was to drive forward on the basis of science, to build stronger science within the walls of FDA, and importantly, to engage with academia and industry scientists to continue to build and extend a strong scientific foundation for FDA's work.
I'm so glad that you are shining the light on how important it is to improve the public's perception on the importance of science in decision making. I think we're at a place in history where many of us in academia and in science are wondering if we are doing well enough in communicating the relevance, the importance of science and evidence to decision making. Mm-hmm. Could you share with us a concrete example of how you were able to break through to a general audience this relevance, the importance of evidence in your decision making capacity as commissioner?
Can I go back to when I was commissioner of the health department in New York? There's some examples from FDA also, but for me, it was a profound experience when I was in New York City's Department of Health to see a hard decision being made on the basis of science. And because it was early in my career, it sort of, I think, helped me as I moved forward. And this was not a decision that I made. It was actually a decision that Mayor Dinkins made. And he was the mayor that hired me in as commissioner. And he actually, I probably shouldn't tell this story in this setting, but he had to go to city council and change the charter because I didn't have a master's in public health. And instead, they put in language about a master's in public health or equivalent experience. But But this had to do with the issue of needle exchange, which was very controversial at the time. And Mayor Dinkins, as the first African-American mayor and someone committed to the African-American community in New York City and beyond, had very strong views about needle exchange and was very, very concerned that needle exchange actually enabled continuing intravenous drug abuse that had been so devastating to so many. And he had campaigned against needle exchange. And when he became mayor, he actually dismantled the one very small needle exchange program that was operating in the city. But there was an article in the New York Times on the front page about a study, dare I say it, from Yale University, that was heralded as the first quantitative study that showed that needle exchange actually reduced HIV infection. And he called me up and he said, I want you to look at this study, because if it's really true, we may need to rethink. And I was actually acting commissioner at the time. I wasn't officially commissioner. And I thought, wow, this is surprising, because he was so adamant on this issue. So I put together a little task force that included a number of people, some of whom I knew, were trusted by the mayor, but for example, someone who headed the Health and Hospitals Corporation, who'd worked with the mayor for years, some academic leaders and others. And we looked not just at that study, but at the whole literature around needle exchange. And I went back to the mayor and I said, the evidence is compelling, and, needle exchange can and should be done to reduce HIV transmission, but in a context that's comprehensive, that ensures linkage into other important medical and social services, that gives addicts not just the opportunity to have clean needles and protect themselves from infectious disease, but also to get linked into drug treatment services and other important services. And I'll never forget when he made the decision to allow needle exchange programs to go forward. At the press conference, he could not say he supported needle exchange. He said he was relaxing his opposition. But the critical thing was that he, as a non-science or medical or public health professional, said we have to look at the data to save lives. And there were a lot of people that were mad at him, mad at me too, about this decision, and didn't think it was the right one. But I had enormous admiration that he was willing to do that, and that we were able to provide the scientific data to support an important program.
That's a great example. That's a great example of how important it is to have the evidence and have that inform tough decision making. I wanted to go back and ask about your leadership style that you aim, in leading the FDA, you took a deliberate decision to lead the FDA in having a global influence. And I wondered if you could share with us, in the process of doing that, very big, bold leadership decision to take for a very important agency, what leadership style did you take on? Was there a particular leader or mentor in your career that you elected to emulate in taking on such a large task?
Well, that's a really big question. I want to sort of divide it up into two questions. One is how, when you start in a new, important, far-reaching role, do you sort of set your priorities, your vision, and how to take on your leadership role? And it was interesting because a lot of people, some former commissioners and some others just, savvy in Washington ways, said, FDA is such a huge and bureaucratic organization. Most FDA commissioners don't last but about 2 years in modern history. Don't think, that you're going to be able to really get that much accomplished. So decide on a few discrete things, that can be done in a relatively short time frame and pursue those. And I came in and I looked at the FDA and where it was and what needed to be done. And I just felt there was no choice but to really take on some big tasks and really try to reposition the FDA for the 21st century and beyond. And that meant, really focusing on building out the science, as we talked about. It meant also, really looking at how did FDA work. It focused on rebuilding trust and confidence that we've also touched on. And it also meant recognizing that FDA operated in a globalized world, and that if we were going to fulfill our mission of promoting, protecting the health of the American public, we could only do it by finding new ways of working globally. It was a shock to me when I got there to learn that on the drug and device side, 40% of finished drugs used in this country are actually made abroad. 80% of the active pharmaceutical ingredients in those drugs was coming from other countries. Somewhere around 40% of medical devices were being made in other countries. On the food side, the numbers were equally startling. About 50% of fruits and nuts were coming from other countries, about 85% of seafood coming from waters outside of our borders. And I might add that those are some of the most vulnerable foods to contamination as well. And there was just no choice. We couldn't pretend that we could use the old approach that the FDA had really been mainly focused on, of screening things as they come across the border. 50 years ago, 75 years ago, more realistically, it might have made sense that you could say, take that tub of molasses off the ship and we'll inspect it and then, bring in the full shipment. The only way that we could really make a difference was to reach outside of our borders, collaborate more with both counterpart regulatory authorities and also industry, but also in some instances to help build regulatory capacity, particularly in developing economies where, a surprisingly large percentage of these products were coming from, because the stronger the ability to provide safe, quality products from the very beginning, the stronger that capacity was, the better off we were. And so we really worked hard to create new collaborative relationships, to share information, in fact, to share workload, because other countries were having the same problems, not to the degree that the U.S. was, just because of the nature of our country. But everybody was struggling with how can we protect the health and safety of our populace when products are coming from all over the world and through these complex supply chains. So we actually tried to create a whole new mechanism for global governance as well, and progress is being made. It takes time, and the world is only getting more complicated. But one of the things that I worry about, frankly, in this current political environment is that we not let a strong nationalistic focus cloud our vision about what needs to be done, in terms of the fact that we live in a globalized economy, and I don't think that's going to change.
Right. So America First really is not incompatible with global collaboration.
Right. And then in terms of leadership style, you asked about, I think everybody has to find their own leadership style, and you have to be true to who you are. And I was sometimes criticized because people wanted me to pound the table more, but that isn't my style. My style is a much more sort of, dare I say, gracious leadership style. I like to listen and learn from those around me. I like to try to move towards consensus. I know that I don't know everything that is important for the job, so I also, like to ask questions and, really, someone once described me as being a steel magnolia, but you have to have your own style, your own voice, and I think for whatever reasons, my style at that moment, probably was an effective one. And, I'm very mission driven. I really, that sense of purpose and commitment. And working at the FDA, the employees are amazing, in terms of their dedication and integrity. And, and I just every day felt proud to work there and proud to be their leader.
That's great. I have a question here that that is related to the definition of healthy. So the Food and Drug Administration currently has an open comment period for public suggestions for revisions to the current definition of healthy, both from the broadest sense and also in reference to front of package labeling on food products. And I'm wondering, are you at all surprised by this this phenomena, and what do you think it means for the FDA and public health as a whole to be reconsidering the definition of healthy in 2017?
Well, I think, first of all, it reflects the fact that the public is much more concerned about issues of health and wellness and what can individuals do to make smart choices for their health and the health of their families. And the amount of interest in the work that FDA did in the nutrition area was enormous. But it's a hard challenge. It's not just the definition of healthy that the FDA has been asked to grapple with, but also natural.
Yes.
And, in some ways, you're getting into the existential when but I think it's one thing to create a regulatory definition for, what criteria have to be met for something to have a certain label or promote in a certain way. It's another to actually answer the whole question. But it's much harder than you would think. And, I think, it's still up to science to help us better understand what are the things. If you just look at nutrition, for example, the science around nutrition is very confusing, and the studies are hard to do, and the database has to be constantly renewed. But even some of the debates around one of the surprisingly controversial issues that I dealt with as FDA commissioner was updating the nutrition facts panel that's on all processed food and many other foods that you purchase. And the issue of whether sugar should just be amount of sugar in the product or whether it should specify added sugar, because as you probably all know, many food products have sugar in them naturally, milk, fruits, all kinds of things. But then often when the product is made, there's additional sugar or sweetener added. And we thought it was important for people to understand what amount of added sugar was in the product, because that essentially represents empty calories. But it was very controversial. The final recommendation was to pull out added sugar. That I think is still being debated in many quarters, and there may be modifications. But I think my goal as commissioner, and I think the appropriate role for the FDA, is to provide consumers with information that they want and need to make choices, and then people can make the choices that they want about the food that they eat. But it's good to have information.
Thank you. I'm going to change gears and go back to a comment that we heard at the beginning of the session about your being voted the 20 most powerful moms. And we're approaching Mother's Day. And we have an audience filled with individuals I know from discussions about work-life balance.
Yeah.
And wonder if you could speak to that a little bit and share with us how you've managed in these very tough jobs, both as the Commissioner of New York Health, but also FDA, how you've managed your leadership responsibilities at such broad, open stages, but also managed to have the outstanding career achievement of being the 20 most powerful moms.
Well, one thing about leadership, I'll just say as an aside, that you learn quickly is that once you leave certain roles, you're no longer on the 100 most powerful women or 20 most powerful moms list. So I don't have that title anymore, I don't think. But, it is hard, and balancing, all the different pressures in life is the hardest task. And I was mentioning earlier that my children are now out of the house, but my elderly parents are now living with us in our home, so that you sort of never get out from under. But I think that one of the lessons is we all have to help each other, and the question of leadership styles. I learned to delegate, not only because it enabled me to go to my kids' recitals or events or get home at a decent hour, but also because that's how you help new leaders grow and how you recognize people's accomplishments and capabilities, and it's how you manage a really complex workload. I think you also have to learn to prioritize. And, one of the things that I always felt was one of my great assets as FDA commissioner was that actually, because of my experience in New York City, I learned to know when something was a real fire and when there was just a lot of smoke. And, I saw a lot of people burn out just constantly, going crazy over crises that weren't truly crises, and in fact, they made it worse. So, learning how to put things in perspective, et cetera. Learning that sometimes you are going to disappoint somebody, either at work or at home, and trying to have a track record where one disappointment didn't undermine, your credibility. And I think one of the things that I tried hard at FDA to do was to make it okay to be achieving balance in your life.
Right.
I was very struck the first week that I was at the FDA, which was, starting that job was pretty terrifying, I'd have to say. But I was going home, and it was like around 7:30 at night, and I had kids at home then, and I encountered a couple people in the hall, and I said, well, I guess I'm the one that's going home early. And these were two men, I might add. But one of them said to me, well, you shouldn't tell people that you're going home. You should say you're going to an event. And I said, no, I'm going to tell people that I'm going home, and you should go home because you have two young kids at home. And, and I think, the leader can set a standard also that there's no shame in caring for your family.
Yeah. Was there a leader or a mentor or some network that you count on in coming to this, the conclusion that you just shared? What were your touchstones when faced with these balance questions in your career?
Well, I was really fortunate in that I had two parents that, I loved and admired, and were incredibly supportive to me growing up, but also had, remarkable careers. And I learned a lot about work-life balance watching them. And also in terms of leadership style, I think, your earlier question as well. So, not everybody is as fortunate as I in that regard. And I would say that one of the things that was a disappointment to me when I was training in medicine here at this great institution, when I was at Harvard Medical School, that there weren't a lot of role models. And I didn't see a lot of people that I sort of said, I want to be like them. And I think, number one, my sense is that medical education actually has been undergoing some changes, and it's better now. But it certainly has made me, especially as the arc of my career is moving more to the end, it's made me committed to really trying to be a mentor and a role model, and to reach out to young people at earlier stages of their career, and whatever I can do, both to provide some wisdom and insight, but also to help open some doors, because it really does matter.
Yeah, it does. I know that as you're at this stage in your career, you have been considering and are actively searching on a number of boards and foundations, and continuing your leadership contributions on a global scale. And I wondered if you could share with our audience, what are some of the things that you think about as you take on these initiatives and new responsibilities?
Yeah, well, this is an ongoing challenge. When I left the FDA after 6 years of really hard work, gratifying work, but I was pretty exhausted, I made a very conscious decision that I didn't want to make another institutional commitment, another major leadership role for a period. I wanted to kind of let my experiences sink in and consolidate, and want to think about, where I really wanted to spend, the next years of my life, and what focus I wanted. And so I was warned, don't commit to things too quickly. But, I went from this intense job to, not having a lot of activities. So people asked me to do things, and they sounded interesting, and I said yes. And then before I knew it, my dance card was pretty full. There also seems to be a phenomenon of nature that all boards and advisory groups meet on the same days. And I would like someone to figure out that scientific issue and a solution to it. But I'm now finding that I'm much busier than I ever wanted to be. I have the luxury of working, now on a range of issues, and with a lot of organizations and institutions that I care about. But I'm still struggling with this question of, it's one thing to have what I've now learned is called the portfolio life,
right.
Where you're doing a lot of different things, and that institutional identity, sense of purpose and mission that comes from, one job that you're living and breathing, 24 hours a day. Yeah. And I do miss that intensity, I'd have to say. I do miss that sense of really making a difference. Every morning when I got up, and every day when I went to bed, I knew exactly, what I was focused on and why. Here it's more diffuse. But, you can make a difference in a lot of ways. And I'm still struggling. You think at a certain point in your career everything is set, but it's a continuing process, no matter how old you are, no matter what you've accomplished. You're always living and learning.
Yeah, I remember when we were talking earlier, you said that you let things unfold, and that's so compatible. Your response is thinking about having the events unfold.
Yeah, and the truth is that I never dreamed that I would pursue the career path that I pursued. I mean, it would probably be quite amusing to go back and look at the letters that I wrote when I was going to medical school, because I thought I wanted to be an academic physician. I thought I wanted to do either reproductive endocrinology or neuroendocrinology. I wanted to teach, I wanted to take care of patients, and I wanted to do research. Then I started medical school, watched the HIV/AIDS epidemic unfold. We were literally taught as first-year medical students that the era of infectious diseases was more or less over with the advent of vaccines and drugs. And then, this strange, inexplicable disease that nobody knew what caused it, nobody knew what to call it, and we certainly had no treatments for it. And then, by the time I was a medical resident in New York City, taking care of so many patients and watching them all follow the inevitable course towards death, really made me think about the intersection of medicine with broader social, legal, ethical issues, made me think also much more about public health, because I, as I mentioned, I didn't have an MPH and I hadn't really been exposed to public health in the way that I think students now are much more in medical school, and I'm really sorry that I wasn't, but I didn't really learn about public health until later, and it was the AIDS epidemic that brought me into public health and health policy and altered my career, inexorably, but I think in ways that have been profoundly rewarding, and hopefully I've been able to make a difference.
I think we're all delighted that Mayor Dinkins did work to change the charter. Because although you didn't have the credentials, you're taking on large issues like TB control, health services for women and children. In those early days in your career in New York, it was very much frontline public health work.
Right.
So thank you for sharing that story.
When I became health commissioner in New York City, my great aunt Winnie, who was sort of like my grandmother, was really upset, though. She said, why can't she just be a regular doctor? Why is she throwing away, because in her world, being a doctor was the best thing you could do. And my father sort of said, well, she is still a real doctor, but now she's got 8 million patients.
That's right. Populations at a time.
Right.
With orientation towards prevention.
Right.
Yeah. I wanted to ask, I'm seeing that we should be wrapping up, and so I'm going to not ask the question I was planning, but will ask you a question that I know our students in the audience and fellows in the audience are eager to hear. And I wonder if you would, across your impressive career, you've offered just here some valuable stories of leadership lessons. And I wondered if we could end, if you could share with our audience 2 leadership strategies that you rely on in the course of your career in leading these large, important agencies.
Well, I think one is, a sense of partnership and collaboration. Get the people in the room that know the most and the people in the room who have the most at stake. And, really listen and learn and try to craft a policy is, one strategy. You can't always do that, and, and you certainly aren't going to make everybody happy, whatever you do. An important leadership lesson is that not everybody's going to like you. And that was a hard one for me in the very beginning. But, it just is true. You have to know that you're making choices based on the best possible information. And I think integrity, I think, that's just, you can't get away from the importance of being trustworthy and having integrity about who you are, about the work you do, about how you make decisions and how you lead.
Very important. I want to take this opportunity to thank you for spending the time with us, with our audience here in the studio and our audience online. And if you could join me in thanking Dr. Hamburg for her time and her warm responses to our questions.
If you are interested in supporting this program and others like this from the Leadership Studio at the Harvard T.H. Chan School of Public Health, please call 617-432-1318 for further information.